Bob and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob SCHRUPP, physical therapist.
Brad HEINECK, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
This video today was put together by Mike and Alex of the Bob and Brad crew. Both are physical therapist assistants and both have been providing treatments to our patients for years. They do
Fantastic work.
fantastic work.
We're very happy with all the work with their patients. We have reviewed and approved all of their material that they're bringing up. So they're showing you our treatment through them with their experience, and it's been
Exactly.
a wonderful.
So make sure you subscribe to the Bob and Brad crew channel, in which they do reviews of products that keep you healthy, fit, and pain-free. They handle all of our new products now. Enjoy the video.
Good luck.
Welcome back, folks. I'm Alex, physical therapist assistant,
I'm Mike, physical therapist assistant.
and this is the Total Knee Replacement Fitness Program. Guidelines to achieve maximal knee straightening, or what else is straightening called?
Knee extension.
Good job. Good
What
job,
if
Mike.
this is their first time seeing us? Why'd you say welcome back?
Well, we have previous videos you need to
Oh,
watch.
okay.
Note, number one, pain control is very important. Practice your deep breathing that we went over in the previous videos they should refer to.
Okay.
And pain medication. Take your pain medication about an hour prior to doing these exercises. You're going to get max results doing that.
Yes. Number 2 is swelling management is very important to elevate your leg. Ice and activities are also key, so make sure you're utilizing your knee motion, trying to work on your straightening. If you're having problem with bending, check out our other video for maximum knee bending exercises.
Yep. If your leg is swollen, you're going to have trouble, getting the range of motion going. So.
Yep.
All right. And the goal in this program is full available knee straightening range of motion, which is the goal is 0 degrees.
Yeah.
But that depends, what you were at before surgery. Maybe 0 degrees isn't, and 0 degrees is completely straight.
Yeah.
So.
Completely flat. Within your first 6 months after surgery is the most important time to try to acquire this.
Yep.
Not everyone will get there. Your surgeon will tell you if it's not optimal for you. If you were limited on your knee straightening before, your hamstrings might be tighter now too, so you might have to work on stretching your knee joint as well as getting your hamstrings limbered up
Yep.
again.
Or your joint capsule's probably tight too in there. So.
Yep.
The quicker you can get your knee straight, the better. So.
Yep.
Get at it. All right, on to the exercises. We're going to kind of start on a week-to-week phase basis here, so 0 to 1 week. So right when you wake up from surgery to 1 week out after surgery, we want you to spend, do 3 times daily, 5 to 10 minutes per session. So not a lot of time because you're probably in quite a bit of pain.
Yep, just numerous times throughout the day. We don't want to take up your whole time purely working on knee extensions.
Yep.
So.
Number 1, this is very important. So when you wake up from your knee surgery and a week out, you're going to want to avoid the bent knee position when you're laying down.
Yes.
So,
should we show what the bent knee position is?
yes, we should.
Where's my pillows?
I'll give you one.
Just one?
Yeah.
Oh.
So the position of comfort is probably going to be having your knee a little bit bent. So like this. He's probably at about 10, 15 degrees of his knee being bent. We'd prefer if your pain, if you can tolerate.
Maybe just straighten your pillow this way.
Yep, straighten your pillow that way.
Try to work on the straightening as long as you can tolerate.
Yep.
Realize it's hard to fall asleep if your knee is hurting.
Yep.
So if you need to bring it back in a bit, go ahead. But try not to have like 2 or 3 pillows.
Right,
and
we don't want to see that.
bent like this the whole time
Yep.
you're sleeping. So if you're sleeping for 6 hours like this, you're going to be pretty stiff and not straightening at all.
Yep, it's okay to do that, to get some rest period, but you're going to set yourself behind the 8 ball if you're doing that for prolonged periods of
so
time.
work on getting rid of the amount of pillows in there over time
Yep.
and work on trying to get it as straight as you can tolerate.
And that leads us to number 2. You can do this a couple ways. Why don't you use it? Should we use the pillow? Fold up the pillow?
Why don't you give me the other
Oh,
thing so I
okay.
can use it for my head?
All right, sir. All right, we're going to give him the heel prop there.
There we go.
So all he's doing, especially early on, he's just going to let gravity kind of push down on his knee.
Take what it can.
Yeah.
And then, especially early on, you can kind of do quad sets if you want, where
Yep.
you're going to engage your quad muscles here and push down into the mat.
Yeah.
If you're really sore, You can just sit like this for 5 minutes or so, just let gravity slowly pull it down. I'm hyper extending. I have beyond 0 degrees range of motion. But just try to work on what you can. If you're here and you can only get to here, that's fine. You're early on.
And if you only start with doing it for 30 seconds and then that's extreme pain, you know, take a little break, sit on the edge of the mat, and then go back to it. You're going to have to work. 5 minutes is going to seem like an eternity.
Concrete black and white evidence for a time frame here.
No.
Everyone's going to vary, so just do what you feel like you can handle without putting too much stress on your knee.
Work up to about 5 minutes at a time and then add in those quad sets if you're really feeling good. I'm going to grab a stool for number 3. And I'm going to bring in the knee glide too because it kind of works for this too. So we're going to pretend I had a right knee replacement. All I'm going to do is I'm going to get that knee that was replaced up on a stool. And you don't want the stool to be too high because then you're just stretching, you know, the muscles. But you want it to, this is probably about 8 to 10 inches.
Yep. This is going to get more of a knee joint stretch versus a hamstring stretch if you have it higher up. Later on, you know, you can progress to a higher stool, but not this early on. Stick to something low.
And this is the exercise right here. Again, gravity is just pushing down on my knee over time, straightening it out. And again, you might just be here. And you can try those quad sets, you know, if you're feeling good. Tighten this muscle, push down.
So the exercise we just did laying down and this are the exact same thing.
Yep.
They're just different positions. That's the only difference. So in the morning or night, if you want to do it in bed because you're in bed, go ahead. During the day, do it in the chair. Pick whichever works best for you. There's not a right or wrong answer here.
And if you have that knee glide, I always like to impress Bob and Brad, you know that. You can use the knee glide for straightening too. So a little easier to get down there.
Been working for 9 years and you're still trying to impress them?
Well, yeah.
Well,
I don't make a good first impression.
I
you know
guess
that.
not.
All right, so that's phase 1, 0 to 1 week. Let's move on to 1 to 3 weeks after surgery.
Okay.
We're still going to stick to 3 times daily, 10 to 15 minutes per session. Let's try to be realistic here. If you say 30 minutes per session, people aren't going to do it. So.
Yeah, it scares. I wouldn't do it.
All right.
I'd do 10 to 15 minutes.
Yep. All right, so number 1.
Is continuous of the heel prop and the quad sets. So the exercise I just demonstrated, have this up. Maybe try activating the quad sets a little more. Try going a little longer duration, laying like this if you can tolerate it.
Yep.
So it's still the same exercise, just try to progress it in some way.
Yep. All right, number 2 here is just continuing the seated chair stretch that I just showed you, but really try to throw in your quad sets now, you know, squeeze that muscle, really try to get that knee straight. And if you want to, put your hands on your knee, give a little overpressure.
Yeah, just stretch a little bit, don't force it. It's better if you can do it yourself versus having someone else push down because they might push beyond your limit if they're not familiar with doing that. I mean, sometimes your therapist might do it, but we've all had a lot of practice, so it's a little different. But I would just do it yourself.
And work on doing this up to 10 minutes per time now. You know, before it was about 3 to 5. Now work up to doing it for about 10 minutes.
And that overpressure might not be something you do 1 week out. That might be more to like 3 weeks out.
Right. Yep.
So it's just going to kind of vary what stage you're in.
Yep. And how your pain meds are working.
Yep.
All right. Number 3. This is a newer one. Do you mind if I demonstrate? You're not moving, so I think you're gonna. I'm going to roll my pant leg up here so you guys can see my legs a little better. So I like to have my patients do it up against a wall because it gives them a little bit of feedback, you know, how far their knee is from touching the wall. You know, you can kind of compare it to the leg that you didn't have surgery on. So you're probably going to start like this. You know, your knee's not completely straight, but you're going to basically do that quad set while you're standing. So you're tightening this muscle and trying to straighten the knee out. And you want to hold it about 5 to 10 seconds normally. And then just relax. Let it come forward. Then I'm going to tighten here. Try to straighten it out. And the goal, you know, is to, if you're standing against that wall, for the back of your knee, you know, to touch the wall. That would mean your leg is almost completely straight. So
Unless you got really big clown shoes.
Unless you have big clown shoes.
Then it might not touch the ball.
That's right.
Number 4 is emphasis on heel striking with your gait pattern or your walking. If you're still using a walker or cane, it's okay. But if you're not, just demonstration purposes, work on letting your heel go first and then bringing through each step.
Yep, this is important.
If you're focusing on actually your heel strike, look how straight my leg is now.
Yeah.
If you're not, if you're just doing this, I'm not getting a straight knee.
Yeah.
I'm kind of babying it. Eventually, start working on it. Your first few weeks, you're going to probably walk like this.
Yeah, it's
to be
survival
honest.
stage your first few weeks. I shouldn't have said that.
You'll survive. You'll be fine.
You'll survive, yes. You will.
Everyone's usually done fine with these.
Oh, yes.
Okay, so focus on the heel strike survival stage.
Well, you know what I mean. All right.
Management phase. How about that? Heel striking.
All right, and the next phase is 4 to 6 weeks out, so you're about a month to a month and a half out. You're really starting to feel good. Your mobility's getting there. So we're going to recommend, again, 3 times daily, probably 15 to 20 minutes per session on this one.
Yep, and
So-
this protocol, this far out, we took out some of the easier exercises, kept some of the good ones, and added a different one.
Yep.
So,
So we're going to start number 1, the seated in chair knee straightening stretch. This one's so important. We're going to keep it in there every
yep,
phase.
this one is still good to do no matter how far out you are, even like up to 6 months. You can
Yep.
still do these if you're having problems with your straightening.
Yep. So you should definitely be doing the quad sets in this phase and probably giving a little bit of overpressure.
Yeah, by this time you should feel comfortable with some overpressure stretching.
Yep. Yep. So work up to like 10 minutes for sure doing this, maybe getting closer to 15.
Yep.
So,
Number 2 is a standing knee extension stretch or knee straightening on a step or a stool. If I
you want
were
the
doing-
chair or the stool?
Yeah, probably the chair. This is probably too low.
Yeah.
As long as you have good balance, if you need to do this at the stairs, hold on to a rail, hold on to a cane, something. If you feel like you're not steady, you don't have to try this one.
Yep.
But this is just an option for you people that are steady. You can put it up on a chair and
Yep.
try to work on letting it get straight. If you want to bend forward, you're going to get a little more hamstring stretch.
Yep.
It's not really going to do much for your knee as much, but you can just bend forward a little bit, stretch into it, hold it for
Keeping the
30
back
seconds.
straight when you bend forward.
Yeah, don't.
Yeah,
do like
don't hunch
this.
forward.
Another option would be something taller yet, if you can handle it. Obviously, I'm younger and somewhat flexible.
What do you consider young and flexible? Holy buckets.
Me.
All right.
But yeah, you can go higher. You can go lower to the stool if this is adequate for you.
Yep.
That's fine. Pick an object you have as long as you feel steady and you're not going to lose your balance.
Yep, yep. Again, we're just changing the angles on the stretch here, and it's important to break up that scar tissue in different spots.
Yep.
And then number 3, we don't need to go through it again, but continue your emphasis on striking that heel when you're walking, because Mike demonstrated when you strike with your heel, your knee automatically goes straight. So
Yep.
you should be mastering that pretty soon here. So.
Master.
All right, and then 6 weeks plus, you're really feeling good. Your knee, in a lot of cases is almost close to 0. you know.
Yeah,
And if
you're-
you're not, don't feel bad.
Your knee
But-
straightening's probably pretty much normal now. You're typically not having as much pain.
Yeah.
You're starting to feel a lot better. It depends, 6 weeks plus could be,
Yeah.
a month and a half to 6 months out.
Yep.
So it's going to vary.
So we're just gonna continue that straightening stretch on your stool while you're in the seated position. Work up to doing it for 15 minutes. And by the end of the 15 minutes, you're probably gonna be experiencing
Yep.
a lot of stretching pain, but that's normal at this point too.
And if you're watching this before you had a surgery, don't worry. It
Yep.
starts out a little more sore and painful, but it gets better. It gets easy. Almost everyone I've seen does really well with knee
Yep.
replacements, so don't be afraid of it. It'll go fine. It's just takes time.
Very good outcomes. And then number 2 in the 6 weeks plus is, as Mike demonstrated, just the standing stretch on the stool, the chair, or the step.
Yeah.
So, but again, don't fall. That's the worst thing you could do on your knee.
Yes.
All right. Thank you. Good luck.
And check
Oh,
out
I always forget.
all the programs by Bob and Brad or us on bobandbrad.com/programs, and check out any other videos related to your knee replacement with the Knee Replacement Fitness Program.
You always have my back.
There you go.